Hello everybody and welcome to this webinar. My name is Karen Broadhurst and I'm your chair for today. We have a lot of people joining today, so you'll notice that you haven't got access to your camera or your microphone. So do please find the Q&A box and put your questions into that. So the programme for today is that we're going to I'm going to do an introduction to the new report, and then we're going to have a series of speakers followed by a panel discussion. Okay, so thank you for joining us. I'm sure more people are joining as we speak. We have about 500 people online, so welcome to you all. And I'm just going to start now the webinar. Okay, you will notice that this webinar is also being recorded. Okay, so thank you for joining us. Today we're launching a new report that's been produced collaboratively by ADR UK and the National Centre for Social Research. And the report showcases exemplary research from across all of our 4 nations and covers new research and exemplary research about the lives of care experienced children and young people. I'm absolutely delighted to welcome our 3 speakers, who include 2 former Children's Commissioners, Sally Holland and Kula Isoma, as well as Sally Cheeseborough from the National Centre for Social Research. So welcome to our speakers. Okay, so before we turn to the report and highlights from that report, I just want to say a little bit about ADR UK. And Irina, I wonder if you could just give me my slides, please. Okay, so this, as I said to you, this launch is being is a launch of a report produced by ADR UK and the National Centre for Social Research. And it's been, all of the research that's covered in the report has been made possible by the use of administrative data. Okay, so I just want to start with congratulating ADR UK. So ADR UK's brief is to unlock public sector data for social research. And what we've seen is remarkable progress in the work of ADR UK in unlocking that data for social research. Okay, so the primary purpose of, for those of you who don't know anything about ADR UK or that data, the primary aim of ADR UK is to unlock the wealth of public sector data routinely produced across our 4 nations and make this data available for social research. I want to emphasise that in unlocking that data, I'm referring to a rigorous process of de-identifying data and making that data available through the highly secure and trusted research environments across our 4 nations. Okay, so the report that we're launching today, I think, really exemplifies the value, illustrates the value of this kind of public sector data. So public sector data is collected routinely by frontline organisations, by policy organisations. It's collected at scale and it's collected over time. And this means that it's an invaluable resource for researchers who simply wouldn't be able to conduct this kind of research without this resource being available. So in terms of the report that we're sharing with you today, if you move on to my second slide, please. The report that we're sharing today really illustrates the application of this data to understand the lives of children in care. So the report's divided into 3 sections, and it illustrates the use of this data across all elements of the child's journey through care. So it's pathways into care, it's care experience and outcomes, and it's also life for children beyond care, which is obviously a critical question. And what you'll see from the report and from the studies that are detailed in summary form in this report is that the studies capture how services or caregiver arrangements are working and shape the lives of children, but also pinpoint avenues for intervention. So I'm now going to turn briefly to illustrate a study from England on my next slide, but illustrate a study, discuss a study in brief from Scotland. Okay, so in terms of a study from England that's included in the report that we're launching today, this is a report from a team at MMU and also Lancaster by Katie Hunter, Brian Francis and Claire Fitzpatrick. It's an outstanding example of what's possible with administrative data, and it's based on a new flagship data set that's been produced by ADR UK in collaboration with the Ministry of Justice and the Department for Education. So the researchers have used a new linked data set to explore for the first time the intersection of care experience, ethnicity and youth justice involvement. I said to you before that what's really valuable about this source of data is the scale at which we can conduct studies. And so this study, looking at youth justice histories and outcomes for children in care experienced youth, is based on a base population of 2.3 children. So 2% of those were care experienced, but you can actually see there the scale of the population underpinning this study. If we move on to the next slide, you'll see the results from this study, which are, I think it's fair to say, groundbreaking. So looking back over the youth justice histories of these children, what we can see is that 1 in 3 care experienced children received a youth justice caution or conviction, compared to just 1 in 25 of non-care experienced peers. So over the period of observation for this study, what you can see is that care experienced youth are far more at risk of being involved in criminal justice. The study also looked at ethnic disparities, again, a really important issue for us to think about. And the findings, again, are quite are new, are groundbreaking, and obviously concerning. So what the study found was that Roma, Gypsy, and traveller community children were much more likely overall to receive a youth justice caution or conviction. But also Black and mixed ethnicity children were more likely to receive a custodial sentence than their white counterparts. So you can see here how this hugely valuable source of data is allowing us to uncover incredibly robust but concerning findings about the criminal justice profiles of children in care. Okay, just moving on to my last slide. I'm going to also talk about our study from Scotland that's included in this report. And this is the work of a team from Strathclyde at Celsius, and they used the Scottish Government's longitudinal looked after children data set. So kinship care is a focus of this study. This is a major and growing source of alternative care giving for children unable to be looked after by birth parents. And so it's important in the context of what is a significant policy shift to look at outcomes for these children. So what this team found was that the majority of kinship carers are grandparents, over 70% in Scotland, and obviously these carers have their own health and financial needs. In many cases, these kinship placements were providing stability for children, but what was also clear from the study was that more needs to be done to improve educational outcomes for these children. So a growing population of children in kinship care in Scotland, and what we see from this study included in the report is that it enables us to think in a more focused way about the kind of intervention. Where do we need to intervene in these children in kinship care families? And obviously educational outcomes was a key finding. Okay, so it's a little whistle-stop tour of studies included in the report from England and Scotland. And now I'm going to move on to introducing our speakers. So I'm delighted to introduce our first speaker, who is Kula Isuma. I'm hoping I'm pronouncing your name right, Kula.
You did very well.
Good, that's great. So Kula is a passionate advocate for the human rights of children and young people. Served for 8 years, an impressive 8 years, Kula, as the Commissioner for Children and Young People in Northern Ireland until March 2023, and now is the chair of the Oberstown Children Detention Centre, as well as being Honorary Professor of Practice at Queen's University Belfast and a trustee at Barnardo's. So Kula is going to introduce our study included in the report from Northern Ireland. Thank you, Kula, and over to you.
Thanks a lot, Karen, and hello, everybody. It's been a while since I've spoken to such a large audience, so bear with me. Marina, if I can have my slides, please. So I'm not going to introduce myself, except to add that I'm a qualified social worker, and I was talking to somebody yesterday. I qualified in 1987, so I've been a practitioner predominantly working with children and young people for a very long time. And something that I want to talk about in the 10 minutes that I have is the intersection between practice and data, and how the two come together to make a difference. Can I go to my next slide, please, Irina? As has already been mentioned, I'm a child's rights advocate, as I think we all are, and obviously particularly Sally, who will come after me. We were children's commissioners together, and I'm very grateful the fact that she was my counterpart in Wales at the time. So we look to the framework and the United Nations, the framework that is the United Nations Convention on the Rights of the Child, and it's not found wanting when we're thinking about data and how we use data. And you can see there general comment number 4, which is article number 4, sorry, which is elaborated in the general comment. So it talks about Article 4 talks about administrative measures that need to be taken. The rest of the convention talks about how children's lives, what needs to happen within children's lives, whether it's within family life, education, play, freedom of thought, religion, so on and so forth. But Article 4 talks about what the state needs to do to understand the lives of children, what the state needs to do to improve children's lives. And it talks a lot in its general comment, which elaborates Article 4, about data collection. Talks about the collection of sufficient and reliable data on children, disaggregated to identify children who are particularly struggling, discrimination, and Karen, you're highlighting the English study is an example that, and it also talks about a whole life approach, a whole life course approach, so we understand the difference of impact as children get older and move on. Can I have my next slide, please? So when we're looking to put it into practice, and that has been some of my experience, particularly in recent years, it's how do we do that? We have our rights and legal framework, and that is incredibly important because it gives us the context, and then how we ensure good and solid data. But as we know, we need to know what the experts and the experts by experience feel. So we need to be able to, using our framework, have our data, but also have the experience of our, in this case, children, young people, and families. They're not the only experts in their lives. There are a myriad of experts, most on this seminar, but what that data means in real and everyday world for children and young people is incredibly important. You can't just have data without understanding how it impacts on the lived experience. And again, the convention talks a lot about children's right to participate, but also in when it comes to data, how we can be a bit more creative around working with children as peer researchers, but also working with children to help us analyze the data, to help us understand the data, and to add that additional context. Can we just to say before, that would have been the model that we would have used in Northern Ireland in the Children's Commission's office, but also it is used across the piece. What do the frameworks tell us? What does the data tell us? What is the lived experience telling us? And then coming out of that, a better understanding. Irina, can I have the next slide? I said at the beginning that I was a practitioner and have been my whole life, only recently sort of going more into policy and change. And how the thing you see on the left, on the top left-hand side, certainly as I look at it, the Northern Ireland Youth Justice annual workload statistics, they've been published for about 20 years. And I would have been one of the people who couldn't wait to see them, and would have sat with my calculator trying to understand the lives of children going through the youth justice system in Northern Ireland. And that calculator was so important because you confirmed what you knew, because you saw those kids coming through the doors of the services that you were working in. It contextualized what you knew and what the children and young people were telling you, but it also gave you some a sort of gravitas, because you could use the statistics, you could use the data to say, it confirms what our young people are telling us. It confirms that there's a disproportionate number of care experienced young people in custody. It confirms that children from certain communities are more likely to be involved with the youth justice system than children from others. But we had to sit there and work on that data. I just want to mention one of the others. These are just some of the ones I just want to mention the one on the right-hand corner, which is the Northern Ireland Children's Social Services data statistics. Colleagues from Northern Ireland on this call, they started publishing this bulletin on a monthly basis during COVID. Actually, it was weekly, but during COVID, and it tells quite a story. What that tells us, and it's verified on an annual basis by NISRA. What it tells us, as far as children in care, children who care experience, since the pandemic in Northern Ireland, we have 775 more children in care. In the 6 months between April and September, 154 children came into care in Northern Ireland, April to September last year. It gives us really clear trajectories about what is happening to our care system here in Northern Ireland. So moving on very quickly to the thing I was asked to talk about, which is the two studies that reference Northern Ireland. Irina, can I go to the next slide? So the first one you'll find on page 18, which is about social disadvantage. And obviously very aware, this was part, the study that is referenced in the document being published today, it was part of a Four Nations study and is not a surprise to any of us who work with care experienced young people. But again, seeing the data in stark reality reminds us that when we talk about poverty is an issue that is a cloud over the lives of so many young people. Wherever we find disadvantage, wherever we find challenge amongst children, young people, we will find often that poverty and social disadvantage is a feature. We don't talk enough about social services, social care, and care experienced young people and the intersection with poverty. And Professor Lisa Bunting's study highlighted in this document reminds us that reminds us that the impact of poverty is that young people, that families are struggling, that parents struggle, not a surprise. And as a result, young people are more likely to get involved with social services and in turn come into care. And it's really timely as the UK government work on a child poverty strategy. And in Northern Ireland, as we're seeing renewed efforts from the social justice sector to get to fulfil the requirements of having an anti-poverty strategy here in Northern Ireland. In another seminar, I can talk to you about whether we need a child poverty strategy or whether we just need an anti-poverty strategy, but that's for another day. Moving on to the next study. Again, start reading, albeit that the data is from 1985 to 1997. But care experienced children, young people dying either suddenly or through suicide. And again, those of us who are practitioners, those of us who have worked young people, and this is what might get a bit emotional, Sally's used to seeing this, when I read this, it made me think of all the funerals I and colleagues have attended over the 35 odd years I have been working in this sector, and the faces of those bright, funny, optimistic, hopeful young people when we knew them, that have gone, the promise that has been lost, and how our society is the poorer for the loss of young people. I'm not saying their names because it just make me cry. But and again, it's stark to see that they are 9 times more likely to be at risk of death, of suicide, and 7 times more likely of sudden death for our care experienced young people. How are we not acting on that? And then finally, just my last couple of slides, moving on. So again, those from Northern Ireland will know, and a lot of you will know Ray Jones. He was over in 2022-23 reviewing our children's social care system and came up with a myriad. It was very, very comprehensive, and worked with a group of young people facilitated by Wojciech, whose chief executive is on the call today. And he did make a recommendation. It's quite a wordy and not probably well written recommendation. But what he's saying is, don't try and put a square peg into a round hole. Develop a system of data collection in Northern Ireland that works for you. Encompass is an off the shelf system that's been picked up from America. We have 5 integrated health and social care trusts in Northern Ireland. Each have their own data collection. So that means us getting an overview of what's happening in children's lives is a little bit problematic. And Ray recognised that in the 50 odd recommendations he made, but he did make a specific recommendation on data. And my final slide, Irina, thank you, is, oh no, so go back one, sorry, that's just a thank you slide, is always, my view is always leave with a quote from a child. And like I said, Professor Jones worked very closely with a group of experts by experience facilitated by VOIPEC. And this young person was very clear that what he wanted when we gather data, whether it's administrative data or whether it's evidence from those with lived experience or evidence from professionals or whatever, what we do with it is make a difference to the lives of young people. And what I hope that today's publication will do is remind us of the job of work that we all have to do across the 4 nations. So thank you very much.
Thank you, Kula. That was a really, really interesting, informative talk. And I think what you've clearly illustrated there is it's absolutely vital that we have data and insights about whether we are realising the rights of children. And you've shared some really painful findings with us. But obviously, these are findings, these are observations that we as academics, policymakers and practitioners need to know. Thank you. So now, Sally, without further ado, over to you. Hi. So Sally is also a former Children's Commissioner, so we're very lucky today, and also served a lengthy period as Children's Commissioner, 7 years, concluding in 2022, Sally. Sally is currently Professor of Social Work at Cardiff Uni, has extensive experience, wealth of expertise in research on children and families, and is currently leading the evaluation of the Welsh Government's Basic Income Pilot for care leavers. Sally, over to you. Thank you.
Diolch yn fawr, Karen, a prynhawn da pawb. It's lovely to be here and always difficult to follow Kula, but I will do my best. So I'm hoping that my slides are now showing, or if not yet, coming through. Karen, would you give me a thumbs up?
Yes.
Yeah, great. Thank you so much. That's wonderful. Okay, so yes, thank you. And I do have to point out that the reason I served 1 year less as Children's Commissioner in Coola is to do the different legal remits in Wales and Northern Ireland, not because I gave up the ghost a year earlier. Yes, delighted to be here today, and I'm just going to show you 4 slides really to talk with some enthusiasm about what administrative data research and data linkage in particular can bring to us as practitioners, policymakers and researchers. And so I'll talk a bit about particularly why it's been important for us here in Wales, but obviously that replicates elsewhere. So I'm going to start by mentioning 3 important issues about why it's so important to me, and I hope to others as well. So firstly, and I think we've already seen some of this in the presentation so far, it can challenge and help us sort of have a deeper understanding of some of our common beliefs about what's going on in our public services. And today we're particularly talking about children's social care. So I'm going to cover 2 examples of research in Wales in the next couple of in a couple of slides today. But what I want to point out just this minute is that without linking data sets, we can reach overly simplistic conclusions from our published administrative statistics. And we just start, and that means that we can start quite expensively pursuing the wrong policy solutions and the wrong practice solutions and fixes. I'm just going to get one quick example from Wales is that on the face of it, we not only have extremely high levels of looked after children in Wales, but that there's a real disproportionality between different rates in different local authorities that is not always explained by levels of poverty, even though we know poverty is a key driver of the reasons why children come into care. Now, by doing further work on this in the Cascade Research Centre, in partnership with our colleagues in Sale at Swansea University, this research has been led by Nell Warner, is that when we combine the data on looked after children, rates in local authorities with some of the common factors that might lead to children coming to care, things like parental substance misuse and domestic abuse, we see that the picture becomes more complex, and some local authority rates that appear very high on the face of it of children being admitted to care can be seen to be less disproportionate once we allow for these different factors. And that's not about league tables between local authorities. That's about making sure that we focus our policy and resource investments into the right places and into supporting the right preventative activities to support children and their families to stay together wherever possible. Secondly, I would argue that using administrative data for research when we can to answer the right research questions is ethical and can be more ethical than other forms of research. Now, often when we work with our public contributors, that's experts by experience, often and professionals sometimes too, they'll raise ethical concerns about administrative data, worrying that we might have access to too much information about people's lives and identify them, and we work very hard, of course, and that work is done in an exemplary way by ADR UK and by Sale at Swansea University to ensure that there's so many layers of protection to stop anyone being identifiable. And we work with our public contributors, people with lived experience, to ensure that they can see those processes and understand those processes. And then it becomes even more ethical that because it stops people being asked questions over and over again about their lives, it means that when they have given permission for their data to be used by researchers, and that it is actually used, and when people have gone through the effort of collecting and collating that data, that it is used, and it stops us bothering our public servants who are so overworked by continually asking them to fill in surveys, etc. So it's really becomes much more efficient, and I would argue ethical as well. And the third reason it's so important, and this is for me probably the first one, should be at number one, is that it answers some of the key questions raised by our experts by experience, people with lived experience, because they so often want to know, why do interventions or access to services seem disproportionate for our group, for people with our experience? They might say, we feel we're over-intervened with, or they may feel they don't get equal access to services. And we can only begin to answer those questions by looking at these huge data sets, as Karen pointed out. So one highlight to do with Welsh data from the report being launched today is the Born into Care data report, which I think has been a really important piece of work, and it helps us understand the care pathways for children over a long period of time, over 20 years I think it was here in Wales. And we know that much of the practice and legal processes are identical to those in England. Certainly the legal aspects concerning admission to care are identical to England, and there's so many practice similarities with the rest of the UK as well. So these results are important for the whole of the UK, and they challenge common beliefs about the legal the impact of legal status on care entry and what happens next. It's a really important study and really helps us think and question why we would use different forms of legal status for children to enter care, and what is appropriate in terms of legal rights of people who are involved in those very high-level legal interventions. So I encourage you to look at that report, which is featured on page 10 of today's report. Here in Wales, I think we're particularly proud of the strengths of data linkage possibilities. Wales doesn't come top of many league tables, but we're really good at recycling. And we're really good, it turns out, in putting data together and linking it and having data available. And that's, I must note that that is done through SAIL at Swansea University, and we work closely in partnership with them here at Cascade. So we have household level linkage. So we not only know what's happening to individual children, but what's happening to other people in their household, which really helps us to know more about their experiences. We are able to link with GP data, which gives us important health information. We have the Schools Health Research Network, which involves nearly every secondary school pupil in Wales and increasing numbers of primary school pupils, and there are care indicators for those. Within that, we are linked to census data, and we'll have adult social care data coming soon. So just really to say that the possibilities are increasing all of the time, and we're able to answer more and more complex and vital questions to make sure that our children and families are supported in the best ways possible. And finally, I just want to give you one more example of administrative care data, which is one that's been led by Cascade. It's not actually featured in today's report, but I do commend this report to you. It's been led by Nell Warner again, with colleagues in Cascade, the Centre for Trials Research and SAIL. And she's looked at lots of issues to do with care entry. I mentioned one of the studies, parts of that study already, but I just want to note this one, which is about ethnicity, about which we've had very poor understanding here in Wales and elsewhere, but particularly here in Wales, and poor data on in the past. Now, we've understood for some time that there not only are that whilst Black and Asian and ethnic minority children are overrepresented in care, that's differentiated by group. Asian children, on the face of it, are very much underrepresented in our care statistics. Nell's gone into that a bit further and looked at parental factors, and she's found that once parental risk factors are added in, Asian children are actually more likely to enter care than those of other ethnicities. Again, that's a really important finding. It makes us really think about our cultural sensitivity for engagement, and also just thinking about where we may need to be putting in more support and preventative resources. So I hope this has given you a little bit of a flavour into the Welsh data and some of the Welsh findings and why these things are so important for us. But overall, just today, I just want to say that as someone who's been heavily involved in policy and practice development over the years here in Wales, and I'm primarily a qualitative researcher by background, hope you'll see why I'm so excited about the increasing possibilities of data linkage for research, for policy, for practice, and most of all, for children and young people's experiences. Thank you very much for listening. Diolch am wrando.
Lovely. Thank you, Sally, and thanks for your enthusiasm. And thanks for that really helpful explanation for our audience of the extremely stringent approach to protecting the privacy of the data subject, which I think is often misunderstood, but that you reference the multiple layers of protection which make it very, very difficult, if not impossible, to identify individual subjects in those huge data sets. I think the point you made about Wales and ethnicity, they apply actually across the UK. Our understanding is in its infancy, and through linking data, we are getting a much more nuanced picture and understanding. Great study from Nell Warner at Cardiff University. Not in the report, but we would encourage readers to look at that. Perhaps Sally could pop the link in the chat for our audience as well. Okay, thank you. So last but not least, Judith, Cheeseborough. Welcome, sorry, Sarah Cheeseborough. Welcome, Sarah. Great to have you with us. So, Sarah, you've got a few concluding points to round off our speakers before we move into the panel. Sarah is Director of Policy Research at NatSen. You've returned there recently, Sarah. Obviously, you liked it. Returned in January 2025, and you're leading a team of researchers undertaking fast-paced, policy-focused research. You've previously held a number of leadership roles in other organisations. So, without further ado, Sarah,
Yes, too many to name here. Thank you so much, Karen. And it really is words of thanks to those involved today, which if I could take this opportunity before I even cover that, to encourage everyone to use my few minutes to put questions in the Q&A. If anything has occurred to you in the previous talks that you would like to follow up for discussion, now is the time to enter them in the click on the Q&A at the bottom of your screen, and that gives Karen a chance to have a look at them while I wrap us up here. And it is simply to express our gratitude at the National Centre for Social Research for the opportunity to help showcase this really powerful and useful analysis for both practitioners and policymakers. I think we've really heard that practitioner perspective today, and as Kula said, that what people already know, but it evidences it so powerfully when working alongside the complex lives of care experienced people. And indeed, we are hugely indebted to the care experienced young people who are not represented directly today, but we acknowledge those who've been involved in this programme to help shape how these research findings should be framed. And of course, we know that ultimately it is care experienced people that will be the judges of the value of this research. And to broaden out a little, if people wish to discuss today, we're really excited at the National Centre for Social Research to be doing a lot more work in this area with administrative data, with policy decision makers to synthesize different data sets, as you've heard today, and analyze information as a powerful catalyst to focusing on which groups in society and which services need the most attention from policy. Speaking to those on the line today in policy, it can remove the need for lengthy trials, expensive evaluations, or at least provide far better evidence upon which to build those new policy interventions in the first place. So thank you again today to our speakers, and we hope you find these findings valuable in your area of work. And please do feel free. I'm pleased to say that I have created the time space for a few more questions to come into the Q&A. And it looks like we have about 15 minutes to turn to your questions now. Thank you.
Lovely, thank you. So now I am going to pose some questions to our panelists. So Sarah, Sally and Kula are now going to form a panel. And I'm going to select some questions from the Q&A to feed through to you. So lots of comments on how important and impactful this session is. There is a specific question for you, Sally, and I'm not sure whether you can answer this or not, but it's come from two colleagues here who are asking what are the parental risk factors for Asian children entering care that were considered in Nell Warner's study. Now, it may be that we want to direct our audience to that study, but I wonder if you can elaborate at all, Sally.
Yeah, I was just looking it up actually. Yes, it is. There are 10 risk factors. I must emphasize before I list these that these are not necessarily, these terms will be quite loaded. They are risk factors associated with children coming into care. I'm not saying these are reasons why children should come into care. Okay, I think it's really important I say that, and I will put a link to the paper in the chat as well. And I know the slides will be made available to people as well, as will with the recording. So the 10 risk factors that were taken from health data were parental drug misuse, alcohol misuse, assault at home, schizophrenia, anxiety, depression, self-harm, learning disability, learning difficulties, and attention deficit hyperactivity disorder. These are associated with children coming to care, and they were also slightly changed and identified by some of our parents from our parents advisory group, who themselves have got experience of care proceedings, who got us to distinguishing learning disability and learning difficulties. These are the risk factors associated, and these were the ones that were measured in here. Someone else I noticed asked a question about the accuracy of these data, and I think the limitations of these data are acknowledged in that paper and the other papers that have been talked about today, because they're mainly from GP data, and we know that not everyone discloses everything at GPs and not everything is recorded. So there are limitations to these data, absolutely.
Lovely, thank you, Sally. It's a really helpful answer. So I'm now going to go to another question, which is about, if people are working with this kind of data, how do they best present and engage with stakeholders? How do they communicate what are the challenges in communicating their findings? And particularly, how do we reach children and families? Sarah, do you want to have a stab at that question?
Goodness. We never stop trying. This is the short answer, isn't it? We, of course, have discussed that we are practitioners and researchers here today, but we're doing everything we can to engage with care experienced people, as we said, to get their framing on how to use this data. And I think all of us here, I defer to the experts across the panel to talk more about the advisory role that those with lived experience must play in everything that we do. And I'm pleased, as a quantitative analyst by profession, to say that I'm seeing that happen a lot more with quantitative as well as qualitative research. And then, given Nat Sen's role, we work at that intersection between academic research and analysis and actually being in the room with Whitehall policymakers and regional policymakers and being able to synthesize that evidence. And I think that's the most powerful skill that we all bring, that we can now talk across a wide range of research projects, and that's what people need. And the administrative data is such a powerful tool to do that, to get to some very, very clear evidence that can't be disputed in the same way that perhaps one small study is. But I would love to pass that to those that work more directly with this.
Yes.
With this group.
Sally or Kulu, do you want to add anything there? How do we reach our stakeholders, and how do we make this data engaging for children as well, children and families?
I'm happy to start, Kulu, if that's okay.
Yes. Yeah, you go.
So it's something that we've prioritised here in Cascade, and our Cascade partnership, which includes SAIL as well, and other partners. And I know this is replicated across the UK, but we have established standing groups of care experienced young people and a separate group of parents who've been through care proceedings and child protection proceedings to advise us. And that's sort of always our starting point. So they not only support they lead on what our research questions are, our methods, but also how we actually disseminate our results and what they mean for policymakers. And we've involved the parents recently in policy seminars for senior government officials as well, to talk to them about what they should be doing about the results. So for us, it's about involving people all the way through. And because of the very difficult relationships that many of the people with the most important lived experience here have been through, we've tended to go for sort of long-term relationships, those people in long-term groups, rather than setting up an advisory group for one, and then dropping those people and bringing in new people, that's how it can feel that people are being dropped. So we're trying to have longer-term relationships, and then they can see, because research takes ages, doesn't it? And you do one study and then another to build things up. So they're seeing the kind of progression of our research, and increasingly we're trying to involve them in the governance of our centre and making having more of a key say in our direction strategically. But it's really just asking people how they think we should do it best, and they're pretty honest. I sometimes produce a report that I think is really accessible, and then it gets torn apart a bit by our young people, and I start again.
Yeah, Sally, that's great. It's a really good example. And as you say, really interesting take on how we create more sort of durable advisory opportunities rather than the kind of stop-start, so that progress can be seen in terms of the research that's being done at Cascade over time, and perhaps how you're listening to your stakeholders as well. Okay, Kula, do you want to add anything?
Yeah, just obviously Sarah and Sally have said a lot of what I was going to say about the experts by experience, but I think there's a group of stakeholders that we haven't mentioned here, which is the voluntary community sector and the social justice movement and advocates, and how we can ensure that that what is published is what is produced accessible to them, because they're the ones who are often engaging with the decision makers, who are engaging on at all levels, whether it's local authority, all the way up to government level. And it's how we can support them and make sure that what we publish, or what you publish, actually I don't publish anything, but what you publish is accessible to them and can be used for a tool by them to achieve social change. So 100% endorse everything about supporting, but service users and parents included, a big beginning, middle, and the never-ending thing that is research, but also how we involve our voluntary community sector and social justice movement in using what is published to affect the change.
Okay, thank you, Kula. So just linked to that point, I'd be interested in your views, picking up on a question here. How do we get a relationship working better between research findings and change? What can we do? Because I think one of the key frustrations probably amongst researchers and probably others is that research sits on a shelf, and even really robust and really findings that are difficult to argue with, as you were saying before, Sarah. How do we kickstart a change process? So perhaps focusing on senior government level. Sarah, do you want to have a stab at that? You're raising your eyebrows, so that's an invitation to come in, I think.
I think I'm agreeing with the challenge, and
yeah,
it is bringing simplicity to that complexity sometimes, isn't it? That we, so defer to the experience of practitioners who deal with the complexity of people's lives at that level. You're talking about how concisely can we express what needs to be done. And again, I'm very excited about the increasing visual representation of findings, for example. We talk about accessibility for the community's research. I have to think about accessibility for senior special advisors as well, at the other extreme. And I would, the power of the voices of those with experience, as you across the panel will know, that when we get those with experience to do a few minutes on a video for us to endorse a piece of complex analysis, it is so powerful, and we're very excited that we often get to do that alongside our research at NatCen. We have a team who will go back and film that experience and really bring the message home. I again open that out to those working specifically with this group.
Yes, thank you, Sarah. Sally or Kula, anything to add there?
Just to say, jurisdictions are different around how you affect change, and in Northern Ireland everything is local. So one of the things has been quite helpful when you're talking particularly to politicians is narrowing it down to how this issue affects their constituents, and the voices, and even the biggest, people who would be most antagonistic towards children's rights. When you say to them in your constituency office, do you have many calls about special educational needs? And it will light a spark. Well, here's the evidence that says. The other thing we did when at Nikki was we followed up on our reports and our reviews and said, so what do you do? And it's different when you're a children's commissioner and have that role than when you're in academia. But you can then use media to say, we published a report a year ago, we've been working with government to implement it, here's how far they've got, here's how far they haven't got, this is what young people are telling us, so that you keep the report alive and you follow it through, and you don't keep it on the, and again, not for the shelf was always a saying we had. This isn't for the shelf, this isn't going on the shelf, this is staying at the desk. And it's how you do that. And that goes back to my point about the voluntary and community sector, how they are really good at keeping things like this alive, because it's the data that evidences and gives and gives more weight to their experiences of their service users.
Yeah.
That was a bit rambling, but yeah.
I mean, I think that was really interesting, actually, of how you can kind of use the local to very good effect, but also the role of kind of mass communication through the media, and holding policymakers to account by looking back, taking stock of where we are now in relation to any major research finding. Okay, we've got a few minutes left, but I just want to pick up on another couple of points here. So observations, really. So one colleague is saying that, there's a major problem around understanding children's mental health. There seem to be substantial problems with linkage to CAMHS data. Can any of the panelists comment on why this is and what we could do about it? I mean, you might not have any ready answers on that and how we can link through to CAMHS data. And we know there's a general issue about linkage to health data. But I don't know if anybody's got any views whether you want to sort of say, this should be a top priority, or whether you might have some kind of magic wand that you can wave in this respect. Sally, you're smiling, so I'm going to pounce on you first.
I was hoping that someone else would know the answer to this. I did give a full confession. I'm mainly a qualitative researcher, but yes, I mean, CAMHS data is absolutely vital. It's a huge issue for all of our, for children who are both recipients of social care services and those who are not, and those who perhaps are trying to access some kind of help. And that linkage would be really, really useful. So we have in Wales linkage to GP data, which helps a bit because referrals often go in through GPs, but increasingly, certainly in Wales, I don't know about elsewhere, you can refer directly to CAMHS services. So through single point of access and our space and wellbeing panels in Gwent. So it's they won't always be in the GP data. So I think it's a nut to crack.
Huge.
Yeah, and Kula, you're saying the same. Yeah,
I think the CAMHS data piece is, and again, a lot of work has been done, and you can see children's journey into CAMHS. What you can't see in Northern Ireland, or the last time I looked at it in Northern Ireland, what you can't see is what happens to them when they're there. You can't always see them coming out the other end either. So that's the challenge, and I think that's some of my thinking is that's because the adult system uses the book they have around people's mental health, and you can have diagnosed mental health conditions. That doesn't work for children because you generally they don't fit into those categories. They don't have, there isn't a system in CAMHS in Northern Ireland that says this is what ails the child and the family. This is what we did about it. This is the outcome, and that's a big thing for us. So we can see the journey in, we can sort of see the journey out, but we can't see what that middle bit, because I think they haven't developed a data set that works for children's mental health and well-being needs, and they try to just superimpose the adult one, and that just doesn't work, is my view from a completely layperson's perspective, and that's deeply frustrating. Outcomes is a huge issue, and I think we need to talk about, we don't understand outcomes in children's social care. We don't have outcomes for children when they enter the social care system or when they enter the CAMHS system, and that is incredibly challenging to understand the efficacy of the services we offer them.
Great, thank you.
If I can build on that, exactly your point, Kula, about understanding the outcomes. We are currently trying to do that retrospectively, working with the Youth Futures Foundation. If there's anyone on this call looking at young people who are currently NEET, not in employment or training, and as an outcome, and looking backwards using administrative data to understand the drivers of that outcome with all the complexity that we've discussed in terms of which data sets are currently available. So of which care experience, no surprise, but is a key driver.
Yeah, lovely. Thanks, Sarah. So if we have health policy colleagues on the call, I think we've got strong endorsement here. Please, can we have more access to data about children's mental health? And also, in general, Sarah, how can we use that data better to understand outcomes? Thank you. So I've got one very quick point that I'm going to raise, but I don't think we're going to answer it in the next 3 minutes. But I think it's to note, and perhaps to note for the broader administrative data community, that there is a question around consent. And we know that data sets have variable approaches to consent, but many would not have individual consent. It's something for the community to look at in more detail. How do we know children and families are happy for the data to be repurposed? Well, we know that all of the trusted research environments across the UK very carefully consult, and for every project that is approved, there is a rigorous process of public benefit scrutiny and approval by audiences, by approvers, if you like, who are lay populations. So they're representative of children and families. I think no study would be approved if it wasn't felt to be in the public benefit. But I'm going to hold on and come back on this consent issue. I know that NatSen will pick up and collate any unanswered questions, because I think it's a really complex and tricky issue. If any panelist wants to quickly say something about that, we've got about 1 minute before I need to wrap up. No, okay. It's a complex issue. I don't think we're going to answer it today, but thank you to whoever has posted that, and we will come back to that issue. Okay, so with 1 minute to go, I just want to thank our wonderful speakers, Sarah, Sally, Kula, and I want to thank NatSen and ADR UK for an absolutely wonderful report. I think that for those of you who haven't read the report, it's a very quick, easy read. It's a great example of how you can distill things down to the absolute essence for busy people. And it'll really give you a flavour of how you can use this kind of data in very efficient and effective ways. You know, and you know, thanks to ADR UK essentially for making this data available with such excellent safeguards around it. So following this webinar, you can access the report via the websites of NatSen and via the website of ADR UK, and we will come back to you with some responses to these questions that are outstanding. So it is now 1 o'clock, bang on time. Thank you to everybody, and a great seminar.
Thank you, Karen.